Hello everyone, I'm Margot Mains, Chief Executive of our local health district. These are indeed extraordinary times, and life in 2020 is a little different to what any of us had imagined, thanks to the COVID-19 pandemic. It has brought significant challenges for many in our community, including residential aged care homes and retirement facilities. You will have seen and heard the confronting stories about aged care homes in recent months, which have rightly raised questions and concerns from family about what is being done locally to prevent and manage a COVID outbreak here. Our priority remains the care and the well-being of residents and staff of aged care facilities. In this video, two of our region's aged care leaders, Patrick Reid and Mark Sewell, will join me in outlining the significant work being undertaken to get homes as prepared and as safe as possible. We know that just one case in an aged care facility can lead to disastrous and tragic consequences. It's for this reason that the local health district is taking the lead on bringing together every aged care provider in this region to work collaboratively to strengthen prevention and preparedness, no matter the size of the site. We know that aged care facilities are people's homes and not hospitals. So to strengthen areas like infection control, a team of our specialist nurses has visited all local aged care homes. Together with our public health team, they are reviewing and making recommendations on outbreak plans, hygiene protocols, the correct use of personal protective equipment for staff, even simple measures like staggering meal times to minimise risk. Together we are developing combined workforce plans that will outline how nurses and other resources can be deployed to support aged care homes whose staff have become unwell with the virus. We are also looking at scenarios that may include COVID positive but otherwise well staff working from their homes so they are able to provide local knowledge to those brought in to help. We want to assure residents and their families that we have a full team including doctors, infectious disease and public health specialists on standby that will immediately respond to a potential case of COVID-19 in a local aged care home. Should a resident test positive and require hospitalisation, they will receive that care and they will be managed within the hospital's COVID guidelines. We also have more than 100 residential aged care beds on standby in facilities across our local health district, which will act as quarantine zones if needed. We are regularly testing and refining scenarios, and we've established a specialised emergency response collaborative that meets weekly to monitor issues, changes, or areas of concern. In the event of a local outbreak, this will escalate into an aged care emergency operations centre that will take control of the management and a coordinated response of the outbreak. We are continually collating information, sharing our expertise and strengths, and taking the lessons of others so that the local health district, together with our aged care providers, can continue to build a strong and a collaborative defence.
All of us are worried about what it would mean if an outbreak of this terrible contagion got from the local community into one of our local homes. Many of us have our loved ones living here, and we are rightfully concerned for them. We are all being affected by this pandemic, as it is having a serious impact on the whole world. Even though each of the more than 40 homes in this region are managing their own affairs under the legislative and support framework of the federal government, in an emergency, it will be our relationship with our local public hospitals and public health services that will matter most. As the Regional Chair for Aged and Community Services Australia, I'm really delighted to endorse the Illawarra and Shoalhaven Local Health Districts strategies. They have established an Emergency Operations Committee with Patrick Reid and me. We are providing the aged care advice about how best to assist aged care services in this area. If anyone wants to contact me at any time about this strategy, please do so at msewell@warrigal.com.au or by calling me on 1800 Warrigal. Whilst there is a long list of things that must be done to prepare for a serious public health emergency, I feel confident, after seeing the results of the Health District's audit of all our local aged care homes, that already a lot of great work has been done. Whilst there are always more things we can do to improve, it is clear that everyone already has a comprehensive outbreak management plan and is determined to keep improving it with this recent additional useful advice. We have been learning a lot over the last few months by watching closely the terrible outbreaks in Victoria that have affected so many aged care homes there, as well as the detailed learnings of the independent inquiry into the Newmarsh House outbreaks in New South Wales. One of the main learnings is that sometimes, in an emergency, confusion between different agency responsibilities can cause delays to important decision making. This is why I believe our local regional partnerships and this very strong collaboration we have is as good, if not better, than anywhere else in New South Wales. I also believe that this collaborative planning will ultimately save lives if community transmission should occur in this area.
The story of COVID-19 for the Illawarra and for IRT is a story in 3 parts. The first part for us has been prevention. We have used rigorous infection control to make sure this invisible invader does not get into our care centres. We have also invested in our staff training and also PPE to make sure that these items are ready should we need them. And making sure that we've looked after our residents through limiting visitation, which of course has been difficult for them and for their families, but has been a major and important part of our plan. So the second part for us is around preparedness. We've developed our outbreak management plans and run them through various scenarios to test them. The other important part, of course, is sharing our plans, sharing with our residents, their families, and stakeholders out in the community. Another very important part has been our work with the local health district, who have come into our centres across the Illawarra to test those plans, to look for gaps and help harden the target against any outbreak we may face. This has been really important work for us to work with, not just the LHD, but also with the other providers of aged care in the Illawarra. This is a really important step in being prepared for any outbreak of COVID-19 in our region. And the third part, and probably the most important, is around collaboration. So as a provider, we cannot stand alone. We've used every resource available to us, working with aged care providers, the local health district, the Department of Health, and also other agencies such as GPs and the PHNs to make sure that we have everything under control. That being said, we're always learning, and that's why collaboration is so important. It's unique that we're seeing this collaboration, but it's something that I think we will continue to do post-COVID. It is a strength of the Illawarra and a strength of the openness that we are to share these plans and be ready.
We hope this information will give you some clarity as to the work going on every day in this space. We want to keep residents, families, staff and the community well informed, so each of you is also able to support our collective efforts. This includes simple measures like physical distancing and hand washing. We know there are many challenges, and our work will continue for as long as needed to put our aged care facilities in the strongest position possible against COVID. Thank you.